Hi, I'm Joe Megibow, the CEO of Purple Innovation, and I'm thrilled to be able to join you today as part of Utah Community Builders' focus on workforce resilience through mental fitness. If you're not familiar with Purple, we are a local Utah based manufacturer of comfort technology products, led with our amazing mattresses and pillows, innovative designs of our own. And as I said, we are fundamentally a manufacturer core, which means we have now nearly 1,500 employees that we've needed to figure out how we can keep safe and productive over the last 8 months during these very challenging times. When COVID 19 first hit, we, as did many, had no idea what was in store and in front of us, and we pulled back. We actually furloughed about a third of our employees, which created a number of challenges right there. Fortunately, within a few weeks, we realized that we were seeing unprecedented demand for our products, and we're able to get most of our employees back to work. And within about 6 weeks, we were fully back to work with all of our furloughed employees. And as everyone adjusted, our corporate headquarters were shut down, our employees on the corporate side were working remotely, and we were adapting and figuring out how to keep those in manufacturing and operations safe and productive. We realized there was a lot we didn't know about what was working and what wasn't working. And we started doing a series of surveys, flash surveys, and a little more formal surveys as we realized we needed to figure out a way to get a feedback loop, a way to actually listen to what was happening and react to what we were hearing. An example of something we heard very early on was something we hadn't even considered and frankly didn't even know was an issue. As part of our standard benefits program that we offer our employees, part of what they get with their medical benefits is an EAP, an employee assistance plan. And what had happened during the first month as we were going through the furlough and bringing people back and all these adjustments is that the number of calls coming into our EAP had increased dramatically. And unfortunately, it wasn't set up for this kind of volume. And what we were hearing was one of two awful responses. Either A, we can't take you, we don't have capacity, we're sorry, or yes, we're happy to talk, but it's going to be many, many months in the future. And for those who are in need and we're reaching out and seeking help, that's just not an okay response. So we regrouped. We were thankful to have this knowledge and looked around to see, are there other options? Is there something else we can do for our employees? And that's where we found Blue Novus, just a terrific program that's really been focused on the emotional health of the employees that they work with and creating targeted individual touch points to help employees through a variety of needs. So we contracted with them. We got it available for our employees. We had to create a campaign to let our employees know about this and that we were serious, that we wanted it to be used. And it was something that was just a somewhat relentless campaign of ensuring that, please, it's available. Don't forget, we want you to take advantage of it. And we saw very high adoption in double-digit percentages in the early days, especially, and has continued to be very high engagement from our employees and our families, which has been a critical part of making sure that as these needs come up, we're able to service them. Now, we continue to dig and we continue to learn, and having a program like this allowed us to continue to engage with our employees. And we heard even more things. Like, for instance, on the corporate side, since we had shut down corporate headquarters, all our employees were working from home. And it turns out, while for many that was great, they see their kids more, they were around more, commuting times were obviously much lower. There were others that this presented significant challenges, which was something I'm not sure we had ever really considered. Whether it was not really having the space and the environment for productive work, given dual working spouses at home, kids at home and distance learning, and limited space and availability to spread out and have the work environment you need to be productive, or much worse things. Those who have been challenged with substance abuse and we're seeing those demons reappear, or marital problems, or other even more awful abuse at home was starting to bubble up, and we were hearing these stories. And we realized we needed to get some of our employees out of their homes and find safe, productive working environments, but our corporate headquarters were closed. And we began to even rethink that. It's, what does closed mean? Do we have to fully reopen them? And we thought maybe we can do something in the middle. And we found a way where we could allow roughly about 10% of our employees to come in on any given day in a very controlled setting. You had to sign up ahead of time. We had all the same kinds of health standards that we had done in our operations and our manufacturing facilities, temperature checks and wearing masks and social distancing. We put dividers up around the cubes. We limited the number of chairs in the office. So we created a much safer environment, but it also solved a fundamental problem we were hearing and talking to our employees, which is we needed to get some of our employees out of their homes and into a safe environment where they could be productive and where they could be safe. And that all came from a fundamental thing we needed to do, which is keep asking our employees, are they okay? Keep giving them feedback loop opportunities where they could engage with us and we could listen and learn. Just the mere asking, I think, has been appreciated by the employees, but the fact that we've been able to identify areas where we're not getting it right or where we thought we knew what was going on, but perhaps we didn't. And we've just continued to realize we don't have all the answers and we need to keep asking and keep listening. So, with that, I really encourage all of you to make sure you know what's happening with your employees, that you focus on taking care of them, as these things are going to rear their heads one way or another, and better to get ahead of it, make sure that they're in their best shape where you can get the productivity you need, you get the long-term relationships you need with your employees, which is obviously great for sustaining a healthy business. And with that, I'll leave you with please stay healthy, be safe, and sleep well.